So hi everyone, my name is Kim Kaufman. I'm the CEO of the Canadian Centre of Recovery Excellence. I'm going to welcome Ian Robb of the Building Trades Association to the microphone to open us up.
Thank you, Kim. Yes, my name is Ian Robb. I'm the former chair of the Building Trades of Alberta, and I'm just here in support of the core document. Our program, Building Resiliency, aligns quite well with it for reasons. The main reason I'm here is we have a young fella, construction worker named Logan, who had his own struggles and was in recovery. Went out to a job site in Alberta here and found that there was more alcohol and drugs on the site than he cared to deal with. Reached out to fellow workers. Fellow workers couldn't help him. Just told him to suck it up and get to work. He went to his foreman. He tried to get some help through his foreman to get a layoff. They told him it would be a quit and he wouldn't be able to work there anymore and he would never be able to come back. He went to his dispatch hall and the dispatch hall had no one to replace him and just left him out there. And the sad story was after 51 days, Logan was found dead of an overdose. What we discovered through this whole process and dealing with the family and talking about this was that, the workers on the site didn't know what to do. They didn't not want to help them. They just didn't know how to help them. The foreman did what they needed to do to keep people on the site to get the job done, doing what they always did. And the hall was the same way. The dispatch center had no one to replace them with the shortage. And so we built the Building Resiliency Program to support workers in the workplace, to educate workers, to reduce the stigma. And we believe that CORE is on the right track for this, and we fully support this. Thanks very much.
Thanks, Ian, for sharing that tragic and deeply moving story. It's a stark reminder of the challenges for those with mental illness or addiction and that those they face in the workplace and what can happen when supports are not available. At the Canadian Centre of Recovery Excellence, we're working to ensure that no one has to face these challenges alone. Recovery isn't about just overcoming addiction, it's about building a meaningful life. That means creating environments, especially in the workplace, where individuals feel supported, valued, and empowered to seek help without shame. Our new guidance document that we're announcing here today, called Recovery Friendly Workplaces, is a call to action. It provides tangible, evidence-based recommendations to help employers create safe and supportive workplaces where recovery is not just accepted, but it's celebrated. It's an opportunity about saving lives, strengthening communities, and ensuring every worker has the opportunity to thrive. I want to take a moment to thank the many partners and stakeholders who've contributed to this work and are joined with us today. It's through this collaboration that we see real change, and I'm incredibly grateful to stand alongside leaders who share this vision. It's now my honor to introduce somebody who's been a steadfast advocate for recovery. Minister Dan Williams has championed policies that recognize recovery as a strength, not a limitation. Under his leadership, Alberta is making bold steps towards advancing a recovery-oriented system of care through the Alberta Recovery Model. So please join me in welcoming Minister Dan Williams.
Well, good morning, everyone, and thank you for taking the time for being here today. And Ian, of course, thank you for that difficult story, but an important story, and tragically not a unique story that we see across Alberta and our workplaces and across all of Canada. I want to thank every one of the stakeholders here with me today, leaders in industry, from their associations, from contractors, and many others I know who share the same interest these industry leaders do, that we want to have recovery-friendly workplaces, that we want to be able to give every single Albertan the opportunity at recovery and make sure that we are welcoming, inclusive, and ready for recovery in the workplace. So with that, I want to particularly also thank CORE for the work they've done leading us. Now, I'll be honest, in government, in research, and in industry, we've had a lot of catching up to do to what individuals in recovery and their families have known for a very long time, that we shouldn't facilitate addiction, not at homes, not in our hospitals, and not in our workplaces. We need to get people the help they deserve, because every single human, every single Albertan living and working in this great province has inherent dignity, and they deserve an opportunity at recovery, to be a mother and a brother again, to be a family member, to help those who are suffering from addiction, I think, is one of the noblest causes and the most important things that we can do in government, which is why this announcement today is so important. And we see this array of industry and research together through the Canadian Centre of Recovery Excellence leading the way, again, here in Alberta. Now, CORE was established only officially a few months ago, and this is our first big announcement that we're making in collaboration with industry on the first steps in Alberta to standardizing and creating expectations for how industry can, on their own, and working with standards of practice and the best opportunities that we have with evidence to create recovery-friendly workplaces. Now, I want to talk to just a few important facts about the nature of what is going on in our province and with those suffering from addiction. We know that somewhere around 10% of employees employed in Alberta have struggled with substance use in the past in problematic ways and are now in recovery. We know that 1 in 5 individuals in Alberta in any given time are suffering from a mental illness or mental wellness challenges. We know that healthier and more productive employees are those who are in recovery, those who have a good understanding of their mental health and their wellness and have resources for it. And we know as well that it's a great cost to employers. We talk about productivity. It's $8,500 a year per employer for the cost of not addressing this when it's averaged across our economy. When it comes to addiction in trades, approximately 50% of those who suffer from addiction have worked in the trades at some point. And 3 out of 4 of those suffering from addiction in Alberta are men. This is important for us to understand who we're talking to and the way of addressing this, meeting them where they're at, and importantly, with policies and procedures that can be adopted in the workplace so that it can be receptive and friendly to recovery. Now, we all know recovery is possible. Workplaces have a unique role in fostering environments that recognize the strength of recovery and the potential it can unlock not just in our workplaces and our society, but again in our communities and our families. This guidance is a blueprint that the recovery-friendly workplaces is coming out for employers to support employees in their recovery journey and benefit from healthier and more productive teams, reduced absenteeism, and stronger workplaces, organizations, and communities across our province. Across this province, we hope to see organizations and businesses looking for opportunities to support their staff, employees, and industry relationships through recovery. The guidance that's coming out of these documents, and we're going to hear more about that later, it can be summarized in a number of different ways. But first of all, workplaces can optimize recovery capital and improve recovery in workers with mental health and substance-related disorders. First, recognize and communicate that mental disorders are common and that no one is immune. It can happen to each of us and the best of us. Recognize that not only is recovery possible, that recovery is more likely than not. It is achieved by supporting affected workers, optimizing recovery capital, and taking steps towards prevention, early detection, facilitating access to care, and offering appropriate accommodations. Third, adopt policies that facilitate hiring persons in recovery and optimizing their retention. Fourth, provide education for all personnel on mental health literacy and curbing stigma against mental health and substance-related disorders in our workplaces. And last, leverage the unique perspective, strength, and skills people have in recovery, which is a strength and not a weakness, to inform our workplace policies and mentor coworkers who are struggling as well. This initiative that is a partnership that has come out of both best practices and research in an academic sense, but also lived experience from those on the job site. An industry that we see behind us is supporting this because they know that this is the path forward, that recovery is possible for Albertans, and this is a moral obligation we have as a government and as industry when it comes to caring for those in addiction. Alberta's government has been a national leader when it comes to promoting recovery for individuals, for families and communities, and now today in the workplace. This guidance released today is a call to action for all employers who want to see their workplaces set up for success. If you want to join this coalition of those to care for your employees, to be a part of the best evidence and standards of practice imaginable, be a part of the organization that is going to lead the country when it comes to recovery, you're welcome to join us here and have your employees also benefit from this incredible set of documents and policies coming forward. I again want to thank those who are standing with me today, and of course, Ian, for that tragic story of Logan. That can be a cautionary tale for all of us to make sure that we have recovery-friendly workplaces, and this document And this announcement today is the start of what that can look like. Thank you all for your time, and I'm happy to take your questions.
All right, we'll do a quick check in the room if there are any questions. Okay, and run to the phones. Any questions over on the line?
Your first question is Kapierskowski from Alberta Today. Please go ahead.
Hi, thanks for taking my question. So you mentioned the prevention side. I know in the construction industry specifically, there's stress from the long work days. There's oftentimes injury and pain. I'm wondering, what is the government doing on the prevention side specifically?
Right. So obviously we're building a continuum of care, and Catherine, thanks for the question. So Alberta's building a continuum of care. Wherever somebody is suffering from addiction, wherever they are, we want to meet them there and give them an off-ramp out of addiction and the tragic end that leads to. As we know, addiction leads to one of only two ends, and Logan's story today reinforces that. It either ends in recovery and a second lease in life, or tragically, the outcome of death. And so we know we want to put all of our resources we can in getting people out of addiction. The announcement today around recovery-ready workplaces, and I'm going to have some of the partners we have today in industry speak to the programming that they've initiated and how this can contribute to it, is not just about reacting, but it's about catching people as they start to have red flags come up in the workplace with peer and mentor support, with access to resources so that those suffering from the challenges of addiction in the workplace can have an earlier intervention. And of course, a prevention piece around awareness and stigma is inherent in the announcement itself with the policies. So I'm happy to have some from industry come up. I know that both Ken and Ian have a lot to say on this. And then, of course, I can ask Cora if they want to add on to some concrete details in terms of what it can look like around early intervention and prevention in the workplace. Go ahead. Sure.
All right. Regarding that question, the Building Trades of Alberta was honored with a grant from the Government of Alberta to build the Building Resiliency Program. It's to represent 60,000 workers and their families. We put in place peer support training for many workers within the industry. We've put in 24/7 app access to give support for breaking free. We use a partnership with Adversity and also with Queen's University for all our training. And as the minister said, our whole program was designed to stop the folks from falling off the edge, like to give them support in the workplace and to catch them before they fall. Our funding was a 2-year funding. The government graciously extended it for a year. Our funding is coming to an end at the end of March, but we believe that we're set up right to just keep going. You know, we're looking for more funding, but at the end of the day, the government's done its part with us, the Building Trades of Alberta, and with the workers in Alberta here to help them keep them safe at work.
Thanks, and I'll maybe add to that. So Dr. Els, who's here with us in the room today, is producing a number of policy guidance or guidance documents related to promoting recovery-ready or recovery-friendly workplaces. The first one today helps to build a foundation on how to enable individuals to start or sustain recovery and how to coach employers through that process within the workplace. There's a number of other policy documents that are coming through over the next many months, including recognizing impairment at work, but also some on the prevention side around reducing stigma in the workplace, the health benefits of workplace, the health benefits of work, as well as recognizing impairment at work, and a number of others to come.
Perfect. And do you have a follow-up, Catherine?
Yeah, I'm wondering how you get buy-in from the workplaces. I know Ian, in his story about Logan, mentioned he got told to suck it up. So how do you get buy-in when there is this sort of culture that enables alcohol and drug use?
Well, a great follow-up, Catherine, and thanks for the question. Culture is important. Culture is upstream of politics. It's upstream of how we organize our workplaces. And so if the government and academics and the media and all of our major institutions in society are saying, don't worry, use drugs, it's not an addiction crisis we're facing, continue to use. We're going to decriminalize because it's really not that harmful, is the message being sent. If you continue to push policies and language and legislation and framing that says there's no issue with drug use and addiction, then of course it's going to be a very, very big uphill battle. Happily, here in Alberta, the culture's changing, and there's a different wind blowing now. It's a hopeful wind where recovery is possible, where we tell people we can deal with this devastating disease of addiction. It doesn't have to end in death. Instead, it can end in a second lease on life. And so that is permeated through all of our government policy, through the research we're doing, through mandates that we have in CORE. It's permeated all the way through into our partnerships with industry. And industry can tell you, and I'm happy to have them come up again and say, it makes a difference, the culture you set and the programs you have and the way that you reduce stigma to say, yes, drug use is a problem, but you yourself are somebody that we care about and we want to see healthy and healing and in recovery. And so that big piece is right from the top. Governments, premiers, ministers, CEOs, senior vice presidents, directors of institutes, our news anchors, our school teachers, all of us, right up and down, need to be sending a singular message to those in our society, young and old, whether it's about early intervention, prevention, or somebody who's in the throes of an opioid addiction and intermittently homeless living in shelters in one of our major urban centers. The message is the same, is that drug use itself is dangerous, that it can take your life, but recovery is not only possible, it's likely, and every single Albertan deserves it. And so that culture setting piece is number one. And if you want to see how that plays out in the workplace, you look at the last 3 years of the program that Ian spoke of, or you can talk about what Dennis has known with CLAC and the work that they've done as well around bringing recovery into the very center of how they think about safe workplaces and healthy employees.
Perfect. And we'll check the phones for our next question.
There are no further questions at this time. Please proceed.
Perfect. Thank you. That wraps up today's conference.
Thank you, everybody, for taking the time today.